Hi everyone. I was down to the Moira River yesterday and took this video footage. A lot of the time when I'm down there, I remove the audio that's natural environment and just leave myself recording. But for this video, I want to leave it on so you can also enjoy all the noise of these ducks that I came across. I had a really wonderful time while I was down there watching them. What I wanted to share in this video is an update for what's happening with my medical treatment. Yesterday I had a phone call from the cancer clinic. It was the initial questionnaire with one of the nurses. Initially, they wanted me to demonstrate cognitive and situational awareness skills, and I was easily able to do this. So then they wanted to know what was actually going on and to provide more background information. The nurse that I was on the phone with was very gracious to me. She understands the challenges with pain. And when I said about the MRI being inconclusive, and I wanted to explain some of the theories that I have about what's going on that might not be cancer in nature, she listened to me, and it also made some sense, and she made statements that I was able to be related to. So the next step in this is meeting with a hematologist on Monday, March the 3rd. So a hematologist is the doctor that specializes in blood-borne illnesses. I was to my local hospital on February 6th and also February 19th. Both times I went to the emergency department. And they drew blood, and the doctors are telling me that my blood's remarkably healthy. My hope is that this is simply my knee ripping itself apart. But I've not been enjoying the wait, because if it isn't that, and something is going wrong with my bone marrow, it's going to be serious. The appointment for March the 3rd is just a discussion and determining direction that should happen with the cancer doctor. From what I know of Ontario's healthcare system, my referral will have already been read over by him, and he'll have an idea already of what should happen. So in short, I think a repeat of the conversation I had by phone with the nurse will take place, and a recommendation for a type of cancer imaging. I've been through this before in 2017, and this is how they resolved that it wasn't cancer at that point. They could elect to go a different direction. They could go right to doing a biopsy, that is, getting a sample of the tissue and looking at it under a microscope. And that would also resolve what's going on with my knee. I will be glad when this is over. This isn't my idea of fun. The other practical part of this is that my knees have both deteriorated, and my right hip is also deteriorating. So in short, I'm really badly needing the 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 hip replacement surgery for the affected hip. I personally see that the knee also needs to be operated on. It's not been doing well for months now. But if I'm willing to get offered hip surgery, at this point it would help. And I am having problems sitting, and the only way to fix that is going to be by operating on the artificial hip, getting it out of me, and putting one in that actually works. I'm still going to have the challenges with the physiotherapy. But I'll have to talk that over with the surgeon. It is a trauma surgeon that's going to be replacing my hip, so I'm not too concerned about having a path for recovery when the typical physiotherapy is not possible. Apart from that, I've been having a lot of problems with pain, and I've been quite weak, and spending a lot of time in bed again. And it's why I haven't posted as much content recently. This is sort of everything I wanted to share about my own health in this particular video, and then I will talk about other things over the next few days that are hopefully more helpful to others. Thank you for watching today's video, and I really hope that you've enjoyed watching these ducks. It was really peaceful and enjoyable when I was down there. Take care. Bye for now.